Welcome to Some Stutter Law.
Newfoundland and Labrador's first podcast.
It's about communicating differently.
I'm Paul.
I'm Laura.
I'm Greg, and I'm a person who stutters.
On today's episode, we have a fascinating conversation between Greg and Robert Kurliand. And Robert is a person who stutters and an SLP, speech-language pathologist. He was born in Israel and is trilingual. He actually speaks 3 languages: Hebrew, Russian, and English. Robert is devoted to understanding the science of stuttering. He believes that in order to manage stuttering, we have to really understand what goes on in the brains of people who stutter. So he's very into neuroscience. One of his specialties is neurodegenerative conditions, and he also is starting his own clinic where he can focus primarily on managing stuttering. So we have a fascinating interview coming up.
Robert and I had a great conversation, and he's a new SLP. He actually graduated in 2022, so Robert considers himself a newbie, and he has what I consider a refreshing perspective on the treatment of stuttering. And it's so important for SLPs now to individualize therapy for the client, because each client approaches therapy for various reasons. But he feels that it's so important to ask the client, what can I do to help you become an effective communicator as a person who stutters. So that was a definite pearl of wisdom for me.
Awesome.
Yeah, absolutely. The thing about being an effective communicator in your own authentic way sort of plays into my favorite part of the interview, where he talks about stuttering acceptance, which is all well and good, but really stuttering appreciation, and for the journey that stuttering has brought you on. As someone who doesn't stutter, but who is part of the neurodiverse community, I love the way that is a bit of a common thread through all of these different types of journeys. Acceptance, it's sort of like, well, this is not a good thing, but I guess I'll run with it. But in stuttering and in things like ADHD and some other ways that people are different from each other, it can also be something that, we appreciate instead. Like, there are parts of having ADHD that I actually love. Like, I am so curious and I can be filled with lots of energy. I love being able to think outside the box. And appreciation puts a nice flavor on it, I think. And so if you also appreciate your journey, or even if you don't and want to hear more about what Robert means, you should like this video, you should share it with your friends and people you love, and you should subscribe to the channel, because there are a lot more great interviews coming up.
And with those thoughts in mind, let's listen to the conversation between Greg and Robert.
So, Robert, welcome to Some Subtle Law.
Thank
we
you.
do have a lot to talk about today.
Excellent.
Robert, based on your little history, you're definitely a role model for people who stutter. Because we often question whether or not we can achieve our career goals. And what advice do you have based on your lived experience?
I think for people who stutter, they might let their stutter kind of dictate the role that they want to take on in the future, or they would let it, at least impact it. And I was reading once on Reddit how someone asked a very similar question to this, and then there were some comments where people said, "Oh, I didn't want to talk to anyone, so I became a computer programmer. I didn't want to talk to anyone, so I became a truck driver." But the problem was, even as a computer programmer, there are actually a lot of meetings that you have to attend. So you do have to speak to a lot of people. And as a truck driver, you still have to do a lot of talking, when you arrive to certain places, when you have to make stops, when things break down, there's still a lot of talking involved. So I wouldn't let talking impact or the amount of talking impact someone's career. I would say to still follow the general advice of follow something that you like, that you think will pay well, that you think can support your life, and something that you can see yourself doing for a long time. And really, really kind of leave stuttering out of the question when it comes to that career choice.
Okay, great. That's great further wisdom, Robin. Great further wisdom. And you're also saying that you work with neurogenet neurogenerative diseases. This is a mouthful for me.
Yeah, degenerative diseases.
Okay, could you elaborate on that for me?
Right. So, um, this would be a disease that someone has that kind of gets worse over time. So for example, something like Parkinson's
Okay.
or something like Lou Gehrig's disease. It's also known as ALS. It's something where over time people kind of slowly lose their ability to speak. First, it starts with say slurring their words, then the slurring gets a bit more severe, and then it could get to a point where they don't have an ability to speak.
I see what you're doing. Okay, yeah. So, Robert, you mentioned that your long-term goal is to establish your own private practice, and that exclusively sees children and adults who stutter. And I mean that's a wonderful, awesome goal for you. You see, and one of the concerns that I have about stuttering, well, first of all, there's very little understanding about the physical component of stuttering. You know, the primary and secondary characteristics, but little attention, if any, is paid to the emotional component of stuttering, what we know below the surface of the iceberg. So, and it's difficult to how would I praise it that there's a number of speech. Well, there's not many SLPs who specialize in stuttering, and even if there are SLPs who specialize, they aren't able to say that yes, I specialize in stuttering. However, I do have an interest. So, do you feel that we need more specialized SLPs in stuttering?
I think so. I think what speech therapists have is that there's a lot that we need to know. Like there are so many fields that speech therapists can theoretically treat. The ones that you mentioned that I see in the introduction, but other speech therapists, for example, they deal with people who have problems swallowing, people who have problems with their voice. Maybe their voice cracks or they have vocal nodules, or anything in that range. Some children, they have childhood roxia, which is the inability to actually, for the brain to send a message to the mouth, for the mouth to say what it is that you want to say. So the field for speech and language pathologist to master is huge. So I think what often happens is that to get comfortable, a speech therapist just knows kind of like the basics or some things on in each part. And therefore it's kind of hard to specialize in one thing because then you're kind of letting go of everything else. Mm. But yeah, speaking with some speech therapists that do see children who stutter or adults whose emotional component is mentioned, like as if it is something that it needs to be addressed, but yeah, little talk goes about how to address it. What's the activity? What are the phrases you use? Is there a step-by-step process to kind of address, these unhelpful thoughts that sometimes actually cause you to stutter more? The unhelpful thoughts that, for example, hinder your communication, as in you wouldn't want to talk, like you would stop yourself from, I don't know, raising your hand in class or asking a stranger for help or for the time or something like that. So I do think that speech therapists need to deal with the emotional component as well. It's just difficult. You do it because we are not psychologists. Do you know, stuttering is one of these conditions that I think would actually benefit from seeing like a speech therapist and a psychologist who really specializes in in the cognitive aspect, in the emotional aspect, in a way. Like, I think that would be the best way to treat stuttering, but in a way, right now, it's mainly the speech therapist that kind of has to take on both of these roles.
That's true.
Which does make it difficult, but it is possible. In grad school, they, again, because the field of speech therapy is so big, grad school can only give you so much. So I think maybe we only had like 4 or 5 classes about that. Dealing with the emotional component was mentioned, but
I know that I see, and I, as a person who stutters, who has many, many yesteryears as being a professional stutterer,
this is
I really applaud SLPs, Robert, to even take on clients who stutter, because I mean the depth of the stuttering beyond the primary and the physical component, but the depth of the emotional component is so huge. I mean, I'm not painting everybody who stutters with the same paintbrush, but for a lot of people, there's so many layers to it, and these layers of emotional psychological challenges can easily impact the benefits of the clinical component, the treatment, of stuttering.
100%. And I think, for some clients, that's something that would need to be addressed. The emotional component. How do I think about stuttering? Kind of also, I think one of the ways to kind of deal with stuttering emotionally is kind of learning the true science behind it. And that, for example, trying to reach fluency and thinking that you'll be a fluent speaker and never have to worry about stuttering again and you can cure it. That's kind of a hope that I do see a lot of clients coming in with. And then we have to be the ones to say, well, there is no cure. Anyone who is trying to sell you cure is is scammer. Really, that's kind of answer to this.
Mm,
But
that-
but once they understand the true nature of stuttering, that it ebbs and flows depending on so many factors: who you talk to, where you are, the topic of conversation, level of stress in that conversation, that it actually has to do with how your brain operates rather than you just being bad at speaking, right? A lot of clients they are coming in and they're in a way almost blaming themselves for stuttering, like, oh, it's my fault.
mhm.
My fault that I am not fluent. I need to be better. When the truth, studies show again and again that there is a clear difference between the brains of people who stutter and those who don't. I think understanding that, helps deal with the emotional component of stuttering.
Mm. In many ways, Robert, you've answered my next question, because I was going to ask you what you thought about the F words, the fluency, and
Yeah. I mean, honestly, I'm exactly against it because there are, tips and tricks to become a bit more fluent. So I still use the word, but I do make sure that clients are aware that 100% fluency, uh, while feeling 100% in control and having 100% no worries and really being cured is a dream.
Mhm, mhm.
And I also make sure to say that in the very first session that I meet a client, because I don't really want to let any hopes kind of linger and grow, and then we have to have this conversation afterwards, and then it's just a bit more painful. So I try
And
to
how, Robert, how do you have this conversation with Herring? Because I mean, my heart goes out to parents, because I mean, stuttering is not only on our minds for 24/7, it's also on the minds of our parents as well. So how do you have this conversation about, you know, realistically, your loved one will not be cured? All we can do is offer targets to help manage their stuttering. How do you have this conversation?
I have it just like that. I mean, I bring it into the conversation. I don't put it on stage. I don't say, all right, there's something that I have to tell you. Are you ready? Are you sitting down? So I don't make it a big deal. I just bring it into the conversation, and I immediately follow up with, there are some things that we could do to try and sound a bit more fluent, but our primary goal is to let stuttering affect you the least as possible, because we would like for you to be an efficient communicator. And there are a lot of really good communicators with a stutter. So stuttering will not stop you from being a good communicator. And that's how I go about it. I say, unfortunately, there's no cure for stuttering, but, and then I go into my quick spiel,
Mhm.
and that seems to work so far.
Right. Now, I also introduce myself at times not only as professional stutterer. I also add to that I am also a specialized. I am also a specialized stutterer that is specialized in covert stuttering. So
Right.
I specialize in covert stuttering. With my history, Robert, I spent so many years trying to hide my stuttering through a lot of the similar tricks and challenges, window dressing, smoke and mirrors. So what's your attitude about covert stuttering?
Right. I think, right, so there are a lot of tricks that people who started develop, like being very good at synonyms. so that you can still say what it is that you want to say. If you wanted to say, this ice cream tastes good, but you're going to stutter on, plant your, perfect, amazing. Or you can just change the whole sentence. I would buy this.
So true. So true.
My opinion is that people who stutter do it anyway. There is this idea in speech therapy for stuttering called avoidance. So like kind of avoid the avoidant strategies came that we came up with ourselves. But I do find that when talking about avoiding avoidance, people who stutter have been doing it for such a long time, and it's so ingrained. It's kind of, it's a really hard ask. So because it's something that you kind of do almost automatically. So I think maybe the more important question is, are you avoiding something specifically that you would really like to say different? Because if I said that, this ice cream is great, I mean, that's very low stakes. I mean, do I really care that I wanted to say good, but I said great? Now I know for other people it might be different, but I think for anything that's low stakes, you sound fluent and you sound in control of your speech and you don't really care, then you can continue moving on with your life. But if there's something that is important that you don't want to change, you should definitely not avoid it. For example, sometimes people who stutter might, act confused or like they don't know something as a way to avoid stuttering and speaking. I know I've done that before. I might be like, I would really like to buy for example, if I'm at McDonald's and I would like to buy a Big Mac, but I would feel like I'm gonna stutter on Big Mac, and so I would like a like I, and you just start thinking, even though that's not really the case. So I think maybe like for things like that, sometimes being okay with stuttering and kind of even powering through is a lot faster and more efficient than pretending to think for a long time and also changing the opinion that someone else has about you where you are thinking about something that is usually a pretty simple order to get.
Mm-hmm.
So that's my opinion on covert stuttering. If you find that it doesn't impact you and it makes you fluent, it is fine to continue. If you find that consumes your brain and you are thinking about it all of the time uh, and you really would like to avoid doing it, then that's something that we can try and address.
Mm. And you call it now. This is new to me. Like avoidance. There
Oh,
too.
yeah. Mm.
I haven't heard that.
Avoidance.
I'm sorry.
Avoiding, avoidance.
Oh, okay.
Yeah. Both words is avoiding, avoidance. That's where the simple phrase is not so simple because it has layers, right? Like because every person that stutters is.
Okay.
If I wanted to avoid the word good and say great, and I'm in control of my speech, and I'm fluent and I'm confident, who cares?
Okay. So I'm wondering now, Robert. We touched on it earlier when you were talking about fluency. So one of the challenges, well, for me anyhow, for years and years, the word acceptance was never in my vocabulary. I would never accept my stuttering, and I didn't even know because I was so covert, and I was specialist in covert stuttering that the thought of it accepting my stuttering was so foreign to me. And so the more that I've gotten involved in the stuttering community, the more that I listen to other people's stories and do research, I find that I'm not really a fan of the word acceptance. However, not to say acceptance is the destination. It's like Ralph, I can't remember his name. I mean, the old familiar quote is not the destination that matters, it's the journey. And for me, I mean, I see acceptance as a destination. However, based on my lived experiences, I reached a point in my life now, because of the hills and valleys that I've experienced, the challenges around stuttering, that I've learned to appreciate my stuttering and appreciate, like I'm able to appreciate my history, my challenges in the past, present, and tomorrow. So I appreciate my lived experience. So so I prefer to use the word I appreciate my stuttering, and it's as if an appreciation, appreciation grows and grows each and every day. So I'm on the journey towards acceptance. So, but acceptance for me it's the P word, puts a lot of pressure on somebody to accept. So I think if we can look back and appreciate our stuttering, our challenges, because my stuttering has brought me here today and talking to you. So my preference is I prefer to use appreciation, but not to negate. But sometimes I think the word appreciation is also another definition of acceptance. So after long-winded saying, so what's your thoughts?
I think it's interesting to kind of look at it that way, that you kind of appreciate the journey that stuttering put you through, the people you met, the experiences you had, because if not for the stutter, you would be a completely different person. And looking back, would you want to be a completely different person and not who you are now? Probably not. I definitely see it. I think I'm going to start using that word in speech therapy now. Acceptance, the way that I kind of look at it is more so accepting the science behind it. It's more so accepting that our brains are different, accepting that there is no cure. Because I find that when you are accepting the science, you blame that people who stutter have on themselves, and the shame kind of goes away. Because again, it comes back to people who stutter feeling like it's their fault that they stutter, that they could be more focused, that they could put more effort and hopefully sound more fluent. But I do think acceptance of the science really helps with overall acceptance. I think acceptance should mean something where you kind of stop working on your communication skills, because fluency, stuttering is just kind of a part. It's just something that affects your overall communication skills. You might stop trying to work on your stuttering, but you can still work on your overall communication skills. And that could be by, standing up straight, speaking with more confidence, speaking, using more specific words to accurately describe what it is that you really want to say, being a good listener and responding to what it is that the other person is saying. So acceptance, I wouldn't do acceptance where you stop working on your speech completely, but I would treat it more of like a journey towards improving your overall communication skills.
Well, I agree with you, Rod, because when I'm talking about when I talk about appreciation, I'm talking about authenticity as well. this is another word I have difficulty with, authenticity. Although that I appreciate my stuttering, you're right. It doesn't mean that I'm throwing out the baby with the bathwater, Like I'm still, I'm honoring my stuttering. However, there's nothing wrong with trying to manage my stuttering. Being honest that, yes, I stutter, but there's nothing wrong with trying to learn therapy targets, which is authentic targets that will help me manage my studying. So it brings in authenticity as well.
I think so too. I mean, do you know what? Part of being authentic and um, part of acceptance therapy, one of the strategies is self-disclosure, right? Like you just simply tell people that you stutter. And when I started doing that, I did find that my conversations with people were a lot more genuine, authentic, more easygoing. Someone would someone would randomly say, "Oh, my brother had a stutter when he was younger," or "Oh yeah, my uncle actually has a stutter." Then you have that instant connection that makes whatever other conversation you have just so much easier. And even if it's not the stutter, people would also often relate with other communication problems like, "Oh, I had a lisp," or "Oh, I was a late talker." And I'm not talking about, for example, clients that I see in speech therapy. I'm just talking about in the real world when I meet people at events.
Mm.
So I do find that it's a good strategy to self-disclose, but I did hear from some people at the conference that don't like it, which was an interesting point of view where they would say self-disclosing is not comfortable to it's comfortable to disclose a part of you to a stranger. Like, I don't want to tell this stranger my secrets or who I am, especially if I don't have to interact with them for a long time. If it's, someone that you'll be having a very short conversation with, do I
Mm-hmm.
have to disclose? Do I care? No.
Mm-hmm. Yeah, and we all have our own perspectives on self-disclosure. But years ago, as I was saying, that I lived many years as a covert stutterer. I would never even think about disclosing it. But now I find that it's sort of once I disclose that I'm a person who stutterer, it's sort of, it's almost, it takes my breath away. It's such a relief. I'm not bound up with all this tension all the time. And so, yeah, sometimes I think it's based on one's lived experience, I think. But each to their own.
Right, right, right. And I find that, mm, I guess, those that might choose to not self-disclose, there's a good possibility that they've been ridiculed very harshly for their stutter. So it's like, why should I disclose something that in the past people have made that have made fun fun of me for?
Mm-hmm.
Whereas I think all people who stutter have probably seen like micro aggressive things in their life where someone would give them a look or someone would, twist their face or say something snarky. But I was but I was lucky enough to never be actually bullied for my stuttering. So maybe that makes it a little bit easier for me to actually self-disclose. But I can definitely imagine someone who has become an easy target because of their stuttering for them to choose to
Mm-hmm.
not disclose it.
Mm-hmm. Well, it also reminds me of of a conversation which I shared with Mary Wood, and Mary has been on some study law a few times. And I remember in one episode, I mentioned to her that I used the word sometimes I have train wreck speaking situations. Years ago, he would sort of upset me for days and days, but now sometimes I say to myself, that was a wonderful experience of stuttering.
I think it's an interesting way to frame it. Almost like, hello, Stutter, you appear again. Nice to see you.
Yeah, that's true. That's true.
How are you, Stuttering? I
Mhm.
mean, yeah, that's positive reframing of stuttering, that it's not this evil thing that you have to avoid, but it's more like this person that you hang out with. And sometimes
Mhm.
they come and they hang out with you, and sometimes they don't. But when they come, they're welcome. What you been up to?
It's true. And I mean, not to sort of paint a rosy picture about stuttering. I mean, there is, for me, there is a definite ugliness to stuttering, but it's who we are. It's who we are, and is who that what I've learned to appreciate. You know, and so anything like that. When I hear people talk about dancing in harmony, I've had a wonderful day of stuttering, whatever. It's the intensity that I I'm challenged to deal with. And so whenever I start out, the intensity is becoming less and less and less. I'm not giving over control to stuttering. I'm taking back control.
So when you say that intensity is less to you, it means that you are thinking about it a lot less, and and it's really affecting your life a lot less when you are thinking about it in those words.
Cor- Correct, because if years ago when I had a bad day, really sort of I've always had a severe stutter, and that severe stutter raises this ugly head. And but now, and then I used to spend days and days getting down on myself about being upset about this bad day. But now it doesn't. The intensity is less thing and less thing. I don't have these lingering hours or days about a bad experience.
That's really good. That is that is one of the overall goals of speech therapy, to make sure that stuttering is not impacting your life. Now that now this is an interesting talk, because I would always think of stuttering impacting someone's life before the speaking event or during the speaking event, as in, oh, I'm so scared I will stutter, or during the event, like, oh my goodness, I'm stuttering so much, but never so much after. And that's a very interesting thought that I think I will implement.
Hmm. Well, it brings into mind that sometimes, but I mean, there's truth in what I mean. I've gone to meetings, and it was in situations that I'm not feeling the greatest, unless I'm upset, I'm nervous. It does impact my stuttering, and it makes me more inarticulate. I mean, remember, I used to leave these meetings so upset, that I could have done better. So I made myself feel worse by sort of getting down on myself. So it's it's a combination of everything. But now with new insight and understanding about stuttering, I'm able to have a different perspective. I mean, for me to say that, and I'm very forthright in saying this, that uh, stuttering is a kaleidoscope of awesome.
It's what?
Kaleidoscope of awesome.
All right.
It has its challenges and opportunities, but it has brought me here today.
And that leads back to the appreciation of stuttering, that it's made you
Correct.
who you are. You are more resilient. Um, I found that stuttering for me, it did make me worry less about other things, because
Hmm.
how much I used to worry about stuttering, that other things just wouldn't worry me as much. I'm trying to think of some specific examples, but for example, if I make food and I burn it, okay, I'll just do it again. If my car breaks down, right, I guess I just gonna go fix it, because my worry for stuttering is the worry about these issues is meaningless.
Hmm. And also, you see, it really makes us appreciate life more. We would become more actively involved in life, you know? Yeah.
Right.
So listen, we'll end now. Do you have any final words for our listeners? Any thoughts?
I think we've covered a lot in this talk. I think final thoughts are, that stuttering is different for every single person. Its severity is different. The way that it impacts their life is different. And also each person has a different life situation and their goals. So whenever they get any advice or if they have any conversation about how to move forward with their stutter, it's going to have to be personalized. It's going to have to be for that individual, because the advice that, for example, a speech therapist might give to person A, it will be different to person B, even if they are both adults and they're both male and they're both in their 30s and they both have careers. The talks will still be different, and because the people are different and the stuttering is different. So I think my advice would be to really think of your own situation and think what can help you in that moment kind of move forward and become a better communicator.
Mm. Well, Robert, yeah, thank you very much for your time today.
Awesome. Thanks again for having me. Take care, Greg.
Greg, another great interview. Thank you for finding Robert or reaching out to Robert and bringing him in for that wonderful conversation.
Well, I really enjoyed the conversation with Robert, because as a sort of a newbie, as he considers himself, SLP, he actually reinforces the focus of in individualizing the therapy for people who stutter, because we all come to therapy with different expectations. But there's a definite paradigm shift in the clinical focus. We're moving from the fluency aspect, emphasis so much on fluency as to what the person needs, the client needs, as more of a personalized approach.
Mm-hmm.
Some Stutter Law is brought to you today with help from Memorial University, the Newfoundland Labrador Stuttering Association, and a whole team of volunteers behind the scenes, without whom today's episode would not have been possible.